Hello, my name is Melissa Pincay. I am going to talk about timing of endoscopy for acute upper gastrointestinal bleeding. Definition: acute upper gastrointestinal bleeding is the most common indication for urgent endoscopy, but the current timing of endoscopy in this patient is still debate. Our systematic review with meta-analysis was aimed at investigating the potential clinical benefit of very early endoscopy for acute upper gastrointestinal bleeding patients.
For patients presenting with acute upper gastrointestinal bleeding, endoscopy allows both identification of the bleeding source and hemostatic treatment of actively bleeding lesions, which reduces the risk of further bleeding and the need for surgery. An international consensus group recommends endoscopy within 24 hours of presentation. But for patients at high risk for rebleeding or death, the optimal time for endoscopy is unclear. A randomized controlled trial comparing urgent endoscopy with early endoscopy in patients with acute upper gastrointestinal bleeding who were predicted to be at high risk for further bleeding or death. 516 patients were randomized to receive either urgent endoscopy within 6 hours after gastrointestinal consultation or early endoscopy after 6 hours but within 24 hours after consultation. The primary endpoint was death from all causes within 30 days. There was no difference in all-cause mortality at 30 days between the urgent endoscopy group and the early endoscopy group. There was also no difference between the two groups with respect to further bleeding within 30 days or duration of hospitalization. 155 patients in the urgent endoscopy group required endoscopic hemostatic treatment during the first endoscopy, as compared with 125 patients in the early endoscopy group. The authors conclude that for patients with upper gastrointestinal bleeding at high risk for further bleeding or death, endoscopy within 6 hours did not reduce mortality as compared with endoscopy within 24 hours. Full trial results are available at nejm.org.
Application of nursing. It is advisable to have a new personnel to carry out the endoscopy. Usually a nurse will receive support from the endoscopist and another person will attend the administration of the sedation and the patient's hemodynamic status. Receive the patients and monitor vital signs, check that the patient or a responsible family member has given the consent to perform the examination.
All right, in this video, I'm going to start in on the gastrointestinal system. If you are following along with cards, I'm on card 99, which starts the kind of dark maroon colored deck. So we're going to talk about some lab values that relate to the gastrointestinal system and what some normal ranges would be. So don't get hung up if your particular textbook or source has these ranges just slightly different. Usually on a test, if you're given a lab value that is out of range, it will be quite a bit out of range. So again, if your range varies slightly from mine or from another source, then don't worry too much about that. So AST and ALT. If these values are elevated, this is indicative of liver dysfunction. We would expect a range between 0 and 35 for both of these values, roughly. Amylase and lipase, if these values are elevated in a patient, this would be indicative of pancreatitis. So normal range for amylase would be under 220. Normal range for lipase would be under 160. Then we have bilirubin. Bilirubin should be under 1, so it should be between 0 and 1. If it is elevated, this can be indicative of liver dysfunction. It could also be due to bile duct obstruction. And then we have albumin. The normal range for albumin is between 3.5 and 5. So that range is a little easier for me to remember because it's the same range as potassium. So that's how I remember. If it is decreased, meaning it's under 3.5, that can be indicative of liver dysfunction, and it could also be indicative of malnutrition in the patient.
Pros and cons. The pros: an endoscopy can help the doctor determine if the patient has gastrointestinal bleeding, diagnose any disease in the esophagus, stomach, or duodenum, allow the stop bleeding by injecting drugs. Cons. There may be cases of perforation of the stomach, duodenum, or the esophagus which may require surgery. Sometimes breathing difficulties, hypotension, or excessive bleeding occur due to allergies to anesthesia or sedative. You can suffer side effects like sore throat or colic. Issue applied in Ecuador. In Ecuador, a study of the timing of endoscopy for acute upper gastrointestinal bleeding, which showed 58 patients at the hospital Eugenio Espejo. In the distribution of sex, they were present in the same percentage from the group of case and control. 60.3% men and 39.7% women. In the case group, the high health percentage 70.7% occur in patients older than 60 years, 29.3% in the patient between 20 and 60 years of age. Conclusion. Acute upper gastrointestinal bleeding is one of the most common medical emergencies. A national audit from the United Kingdom estimates accurate overall in-hospital mortality of 10% after acute upper gastrointestinal bleeding. Endoscopy allows identification of the source of bleeding, as well as hemostatic treatment for actively bleeding lesions. Endoscopy hemostatic treatment of high-risk lesions stop bleeding and reduce the risk of further bleeding and need for surgery. Thank you very much.